the screencast-o-matic ended up cutting me off. So, back to what I was talking about. Special considerations when you're working with someone with MS. Muscle spasticity is an important factor. So, you may want to use something that you can strap their feet in, and that way you don't have to worry about the foot either sliding off or the possibility of a muscle having a controllable twitch or a jerk. Sensory loss. So if this happens, they're most likely going to end up being placed in a wheelchair just for their own protection and safety. And if that happens, it may preclude upright activities such as walking, running, and you'd have to modify what types of exercises you're going to do with them. And some more special considerations, muscle paresis. So if this happens, it's not exactly paralysis, but it's on the way to becoming paralysis. So you may have to reduce the intensity or the duration, and possibly both, of your exercise prescription. And there's also psychological components. So it can affect motivation and can increase their frustration, especially if they're having some sort of cognitive deficit and you're having to repeat yourself multiple times in order for them to understand the directions, or if they're forgetting things. And that just leads to them not having a pleasant experience. And then progression. This is not exercise progression, but progression of MS. It is going to get worse. As it progresses. There's nothing that exercise can do to prevent it. Medication and exercise may help slow it, but it is going to get worse. So, as it gets worse, their impairment, so whether it's cognitive dysfunction, they go from being able to walk to now they are in a wheelchair, they're going to have an increase in what they can't do, as opposed to what they're able to do. So cognitive deficit, this goes along with the psychological that I mentioned a moment ago. It can affect their understanding, memory loss. So you may have to repeat yourself, or you may have to explain something in multiple ways. You can also go ahead and have written directions, or if they have home exercises, you can also have pictures just based on what is going to help them and their state. So symptom recurrence and exacerbation. And during an acute exacerbation and of their symptoms, they should actually be encouraged to not exercise until it's resolved. And then afterwards, you would want to repeat the exercise testing and just to see how that exacerbation and impacted where they were. Okay. And you would modify what you're doing with them in terms of exercise from that new testing. Urinary issues. So several people with MS, like I mentioned in an earlier slide, have issues with either urinary incontinence or frequency, urgency. They may have a spastic bladder. And because of that, they may actually decrease how much water they're drinking in a day, which is the exact opposite of what they need to do when they're exercising. And they do this not from a medical standpoint, but more from an emotional, psychological standpoint. So what you need to do is try to have them exercise not only closer to a restroom, but also make sure you have water available as well, and encourage them to drink water and explain to them that they need to drink water. That way it can help with medication and distribution, and also help with the heat sensitivity. So just a little summary of what I've talked about. Like I said, and if it's a mild case, slowly progressing, or it's in the early stages, there's actually people who have MS and don't know it. And the only reason it gets discovered is after he passed away, an autopsy was done, and it was found. People in that situation, and the exercise prescription is very similar for those with no MS or other chronic disease. Exercise may help slow the progression, but it won't change prognosis. It is going to progress, and it is going to get worse as time goes on. Just with each individual person, and the speed at which it progresses is going to be different. Testing and exercise sessions should be done in the morning, and that way the fatigue will have less of an impact on it. Then you want to take steps to increase safety, so this would be using the cooling fans and adjusting the temperature of the facility. That way you address the heat sensitivity, and they're less likely to have an issue in terms of becoming overheated. You would also use the foot strap, so that way you don't have to worry about a foot slipping off of a pedal. Functional activities actually have the best carryover to their day-to-day life. So this would be your sit to stand, sit to walk, and other functional exercises. And you want to use RPE, rate of perceived exertion, so that 6 to 20 scale with about 11 to 14 being the range you want to be in for moderate activity, as well as heart rate to evaluate intensity, because several people with MS, as either because of the disease or the medication they're on their heart rate and blood pressure don't respond the way it would for a healthy individual in terms of exercise. So in that case, you would want to use that perceived exertion. And some more special considerations, you want to think about the medication side effects, so whether it's the flu-like symptoms, fatigue, cough, shortness of breath, and adjust what you're doing from there. You want to educate on the different types of fatigue. So whether it's fatigue from the MS or fatigue from exercise, that way they understand what they're feeling after an exercise session, and if they're more fatigued than they were at the beginning, and they understand that that's normal, and they aren't worried that exercise is actually making their fatigue worse. Heat sensitivity is common, so again, use fans, have cool water available. You want to educate them on the need to increase fluid intake because they're exercising. That way, they understand why you're encouraging them to drink water, especially if they're having issues of incontinence to where they can't hold it until they get to the bathroom, or they're having to go several times during a session. And that way they're not embarrassed and they know that you understand. You want to be prepared in case of a cognitive deficit, so whether it's you already have printed instructions on how to do different exercises, or just preparing yourself mentally to be more patient, and maybe you practice with somebody. That way you get used to having to repeat yourself, and you won't get frustrated when working with someone with MS, because as you becoming frustrated can lead to them becoming frustrated, and it's just a vicious cycle. And you want to watch for signs and symptoms of the Uthoff phenomenon. This is an acute and usually transient, so it usually lasts for less than 24 hours of an exacerbation of symptoms. This is actually fairly common, and you just want to be aware of it. That way, if you notice the signs and symptoms, you know you need to reschedule a session if necessary. Okay. And then these are some different references that I used. And I just want to thank you for your time and your patience, and have a nice evening.